Thank you for the opportunity to speak to you about access to medicines in the post-pandemic recovery. Before we get to the recovery, I want to note that even before COVID-19, Canada had the unfortunate distinction of being the only high-income country with a universal healthcare system that did not include universal coverage of prescription drugs. You likely know that virtually all costs of medical and hospital care in Canada are publicly financed through our Medicare system. In contrast, only 43% of the cost of prescription drugs used outside of hospitals in Canada is financed by public drug plans. That 43% of prescription drug costs is financed through a patchwork of 114 different public drug plans. These public plans are akin to small umbrellas that provide targeted coverage for specific segments of each of the provinces. Coverage under these public umbrellas, if you will, varies depending on age, income, disease, and province of residence. Thus, Canada's healthcare system relies very heavily on private financing of medicines. About 60% of Canadians have some form of private drug coverage. A vast majority of this coverage comes through work-related extended health insurance plans. Like the myriad of public drug plans in Canada, these private insurance plans are also akin to tiny umbrellas, but for much smaller, more exclusively defined groups. There are literally thousands of different private drug plans in Canada. Each is negotiated and paid for independently by different employment groups. You see, contrary to the international declarations that have determined that access to necessary medicines is a fundamental human right, we treat prescription drug coverage in Canada as if it was a privilege. And the privilege of having private drug coverage in Canada very much depends on socioeconomics. That is, on status, not needs. The effects of income are particularly strong. Approximately 3/4 of Canadians with household income over $80,000 have private insurance for prescription drugs. In contrast, just 1/4 of Canadians with household incomes below $40,000 have such coverage. Overall, our patchwork of private and public drug plans leaves about 1 in 5 Canadians without coverage for the prescriptions that they or their family members need. Canadians aged 25 to 44 are most likely to fall through the cracks of our patchwork of private and public drug plans. But this is not just a matter of age and employment. There are structural inequities in our so-called system of private and public drug coverage. For example, whereas only about 1 in 5 whites in Canada have no coverage for prescription drugs, nearly 1 in 3 visible minorities lack such coverage. Furthermore, immigrants are more likely to fall through the cracks in our system than non-immigrants. Indeed, even after adjusting for income, education, health status, and work type, immigrants are less likely to have prescription drug coverage than non-immigrants in Canada. That lack of coverage matters. Here is a slide showing the percentages of adults in various countries that reported skipping at least one prescription in 2016 simply because of the out-of-pocket cost. All of the countries in blue have what are more or less universal single-payer public healthcare systems. Of course, their healthcare systems differ, but they are primarily publicly financed at a population level, which makes them reasonably comparable to Canadian Medicare. Importantly for this talk, all of these countries provide universal coverage of prescription drugs for people of all ages and all incomes as part of their universal healthcare systems. Moreover, patients in all of these countries pay limited co-payments to fill prescriptions under their Pharmacare systems. The lowest prescription charges are in Scotland and Wales, where prescriptions are free for all residents regardless of age or income. The highest charges are in Australia, where working-age residents pay an equivalent of 35 Canadian dollars per prescription. The data on this slide shows what you would expect. Patients do not frequently report difficulties affording prescription drugs in countries with universal Pharmacare systems involving little or no charges for the prescriptions filled. In Canada, where there is an incomplete and inequitable system of drug coverage, 1 in 10 adults report skipping prescriptions because of out-of-pocket costs. Now, to put these numbers in perspective, if Canada were to achieve the average rate of access to medicines found in these comparator countries, 2 million Canadians would be filling prescriptions that they are currently foregoing. These skipped prescriptions have an impact on patient health. In 2016 alone, 374,000 Canadians reported having to use additional medical and hospital services because their health was compromised by financial barriers to medicines they needed. More tragically, research indicates that at least 300 Canadians die prematurely each year because of cost-related barriers to basic preventative cardiovascular treatments alone. And what is particularly infuriating about our lack of action on this problem is the fact that the solution would not only save lives, it would save money. This slide shows the total amount each country spends on pharmaceuticals per person in the population. This includes public and private payments for medicines used outside of hospitals in these healthcare systems. The first thing that jumps out from this slide is the fact that Canadians spend more on medicines than any comparable country with a universal pharmacare system. Canada spends almost $900 per capita on prescribed medicines outside of hospitals. In contrast, on average, these comparator countries spent just $444 per capita on prescription drugs outside of their hospitals. Let me put these numbers in perspective. Even if we only matched Australia's financial outcomes, we would still save $7 billion per year. I know you're probably now thinking, how on earth are we overspending by at least $7 billion every single year? There isn't enough time to go into the details on this slide, but I have done several studies on this question, and each of them finds that Canada spends a lot more on medicines than comparator countries do because we pay higher prices. This is true of brand name drugs and generic drugs. It all comes down to purchasing power and price negotiations. Bulk purchasers, that is, national pharmacare systems, obtain better deals. The financial differences matter to governments, households, and employers. This slide shows the average per capita expenditure on prescription drugs that is financed directly by households or employers. It makes it clear that universal public pharmacare systems in these comparator countries keep the direct costs to households and premium costs to employers down. Yes, the businesses and households in these comparator countries pay taxes, but their pharmacare systems provide far better access to medicines at lower total cost to the economy through mechanisms that ensure that no household is put at financial risks because of the needs of its members, and no business is put at financial risks because of the health of its employees. Canada's patchwork system of private and public drug plans, on the other hand, results in massive direct costs to patients and employers. The strains on families are real. In 2016, nearly 750,000 Canadians reduced their household budget for food in order to afford the out-of-pocket costs of medicines they were prescribed. Let that sink in. Nobody in Canada should be contemplating whether to pay rent, put food on the table, or fill the prescriptions that they or their family members need. Yet we let this happen. And we let it happen disproportionately for households with low incomes, people of color, and immigrants. So to sum up, our patchwork system of private and public drug plans provides worse access to medicines at higher overall costs to the economy with greater financial risks to employers and households than universal public pharmacare systems do. Although this slide looks depressing, it actually contains a remarkably positive message. And that is that every comparable high-income country with a universal public healthcare system like Canadian Medicare proves that we can have a pharmacare system that would provide better access to medicines at lower overall cost to the economy while better protecting employers and households from financial risk. So, in the midst of a global pandemic and economic crisis, you might be asking why now? The short answer is that it is the right thing to do. It always has been, and it still is now. Additionally, now is no time for Canadians to be skipping prescriptions because they cannot afford them. We need to do everything we can to be keeping Canadians healthy and therefore out of our hospitals during this crisis. Furthermore, millions of Canadians have lost their jobs during the COVID recession, and with those jobs, they have also lost their prescription drug coverage. These job and insurance losses fall disproportionately on middle and low-income families, precarious workers, and other vulnerable populations. Thus, Canada needs universal public pharmacare now more than ever. Finally, every credible study about the cost of a universal, comprehensive public pharmacare program, including recent studies by Canada's Parliamentary Budget Officer and Canada's Department of Finance, finds that such a system will save Canadians billions of dollars more than it will cost government to run. So when planning a post-pandemic recovery for Canada, the choice isn't Pharmacare or another program. The choice is Pharmacare and another program, because Pharmacare will literally save the money needed to do that other thing. So I hope you will agree. Universal Pharmacare is an idea for which the time has come. Every comparator country proves that it works, it saves lives, and it saves money. The pandemic is no reason to put this off. Indeed, Universal pharmacare is needed now more than ever before. Thank you.